Hi, my name is Karen Zaneta, and I am one of the instructors here at Northland College. The demonstration I'm going to do today is that of an NG insertion. There's different reasons why an NG can be put in, as you know. The reason we're going to do it today is we're going to say that this gentleman got admitted up to the floor for a small bowel obstruction, and he needs an NG inserted and put to wall suction. So the first thing that I'm going to do, after I've explained it to him, what we're going to do, and I've identified him, checked the orders, I'm going to do just a focused assessment on his abdomen. So I'm going to be listening just to see, are there bowel sounds, are there not bowel sounds? You know, is it firm? Is it hard? Is it tender? You all know what you need to do for a focused GI assessment. So that's what you would do before you put the tube in, because after I'm done, you're going to probably do it again later to see if there's been any change. Has the NG helped? Anyway, that's a whole different lecture. So we need 4 supplies. You need a cup of water with a straw, because that's going to be for him to hold. You're going to need an emesis basin, because if it hits his gag reflex or he has a full belly, you're going to need some type of drape of some sorts, just in case. You're going to need lubricant, and obviously you're going to need your Salem sump. Again, there's different types of sizes of sumps that you can put in and different attachments. We're just going with a really basic one. The other thing you're going to be needing for irrigation, which I'll show you later, but you're going to need a piston and some water for your flushes. You're going to need a pH strip, because we're going to check the pH of the aspirate to see what it is. So I am going to get my tube out here, and the first thing I'm going to do is put it like this. And I've got another thing over there too that I should go get. It's right there. Thank you. And perfect. Put your lubricant on here. Now, when you're doing this for a demonstration, a skill validation for us here at the college, I'm going to be showing you, that you're using the lubricant, but don't be putting the lubricant on and then into the mannequin unless you want to clean it out. So just don't do it. Simulate it, just like I'm going to do for you. Okay, this is a clean procedure, so there's no sterile anything, but I'm going to put my gloves on, and I'm going to measure this tube first. Like I said, you want to always make sure that you've explained this to the patient so he knows what to expect. So, and there's different ways you can prep this as well. Some people, and I think it says in your book too, you kind of want to coil it and you can stick it in ice. That makes it a little bit firmer so that it'll go down better. Other people like to have it a little bit more limber, so then they're going to run it under warm water. So I do believe your book says to put it into ice so that it goes down easier. But I am going to measure from the earlobe to the nose, down to the xiphoid process. Now there's different ways now again to mark it. I've got it here. Take a small piece of tape, and then you can put that piece of tape around there. Then you know how far you have to go down. Otherwise, you can just look at the number and know how far to go down by looking at the number here. All right. Next thing, I'm going to have him hold on to this water, because once I get past the oropharynx, he needs to drink, because that drinking is going to help the tube go down. And he's not going to want to, but all right. I'm going to lubricate this, simulating it again, and I'm going to first make sure he's in a high Fowler's position. When you first put this in, you want to tip his head backwards so that you can see where you're going. And you want to go in a nair that, if you check the nairs, have him breathe in, and see if one is more clear than the other. I'm going to say that his right one was pretty clear. So I'm going to have him tip his head back, and you go in. Once you get past the oropharynx, you can take a breather. Don't let go of the tube though. Just give him a little breather, and then just have him hold his water and bring it up here. And then as you tell him to drink, he's going to be drinking. And each time he swallows is when you're going to advance the tube to go down. So now he's going to put his head forward, because then that just helps it go down so it doesn't go into the lung at all. So going down into the esophagus and the stomach. So he'll put his head down. And then I'll say, go ahead and drink. Drink, drink, drink. Keep drinking, keep drinking. Until you get up to your tube, and don't let go. If I had a flashlight, I'd take a flashlight, or you can just look in his mouth. Make sure it hasn't coiled in his mouth. Then I am going to take, again, do not let go, a piece of tape, and I'm just going to put this on there for just some temporary, just to hold it in place. Actually, that isn't too bad. We're using this, but there are nice nose holders that each facility has, so that will work fine. Remember now, I had this like this because if you had it open, if his stomach was completely full, that stuff would be coming out. So make sure you have this clamped one way or another. So the next thing we want to do is check placement to make sure we have it in the place that it's supposed to be and far enough down. The best way is to send them down for an x-ray. So that's what they would do. They'd order an x-ray or come up and do a flat and upright. Make sure that it's in the right placement. Other thing you can do is take your piston and clamp that. Oops. And you could take some of the aspirate out. Clamp that again. And put it onto your pH tube. And then just see what number it gives you. Now, you will see another type of procedure that is done that isn't recommended. And the only reason I'm going to tell you about it is because you will probably see it in practice. Doesn't make it right. But some people, you'll see some nurses that will get a bit of air in here, let's say about 20 milliliters of air. And then what they will do is they'll clamp that off, the piston in there, and then they'll take their stethoscope over the fundus of the stomach and they'll push the air in and listen for the air. It's not a very accurate way, and that's why it's not recommended, but I just wanted to show you in case you do see that out in practice. And I get my suction. I turn the suction on, and then put the extender in there, if you want to call it that, and then watch what type of returns you get, and look to see how much you get. You can see how much it's filling up in here. Look to see what color it is. See if he is feeling any better, because if he's very nauseous and then you've put this in, it should help with the nausea. So you're just taking note of everything that is coming out and the color of it and with the suction on, whatever was ordered. So just to review, you've got your tape here securing the nose hose there, and you've got a piece of tape over the tube to keep it on his gown, but give him enough room so he can turn his head and that it won't put any tension. Then we've got it hooked, and then just make sure you've got this here. The one other thing that you will see done, and your book does talk about it, is to add air to the pigtail. Now the reason that you can do this is that if your tube goes into the stomach and then you turn that suction on, what can happen is that the tube will go right up to the side of the stomach because of the suction. So if it's right up on the side of the stomach, it's not going to be taking all that, whatever contents are in the stomach. So you want to just push it out to the side. So then what you would do is just get that little, 5 mils of air and put it in the blue. The only thing that goes in this blue pigtail is air, nothing else. And you just put that little bit of air in and put it back, blue to blue. That's the only thing that goes through the blue. Make sure you remember that. Don't be flushing anything in the blue pigtail. It's just for that little bit of air. And so I think we've got everything done here, and then I would go ahead and chart whatever I put in, how much that came out, the color. You can write how he tolerated it, but they're not going to tolerate it very well because it's not a very pleasant procedure. And I think that pretty much sums up for the insertion of the NG tube.